Good morning and welcome to Ask Dr. Murphy This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing great. Thank you, Katie.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, he will be answering a viewer-submitted question as well as addressing the latest headlines through today, May 27th. We invite any questions or comments down below or at any of our social media linked in the description. Starting today with an update on the Ebola virus outbreak. Dr. Murphy, what can you tell us?
Well, the number of cases is reported at 900, which is probably a gross underestimate. But at 900 suspected cases with 234 confirmed deaths, the majority in the Democratic Republic of the Congo, but also affecting parts of Uganda and South Sudan. What's new is a couple things are new. One is anyone coming back from that area who's allowed into the United States, which has also changed. But anyway, they had to go through Dulles Airport in Washington, D.C. During the last Ebola epidemic, there were 5 airports they could come through, including Chicago. So they opened up 2 more airports. So they can go through Atlanta and they can go through George Bush International in Houston. So those 3 airports will take anybody coming back from any of those 3 countries. And the other thing that's changed is citizens from those countries and visitors to those countries who are not residents of the United States aren't able to come anyway. And that's why that one plane got diverted to Montreal a little over a week ago because they had somebody from Congo on there. What has changed is the green card holders are not going to be allowed back in the country for 30 days as of last Friday. So citizens can still come back. They have to go through one of those airports and get screened, and they will tell them what has to be done, if anything.
Mhm. So we will keep our eyes on that case count. Of course, it does continue to go up, but as a reminder, the risk to the public here in the US does still remain low.
Yeah, and this is the first time we've really seen a difference between citizens and green card holders, residents. I mean, it's kind of interesting. It's probably not a very large number, but they're making a point of this for some reason.
Definitely an interesting distinction there. But we do have an excellent submitted question this week from a longtime viewer. And they asked, will there be an updated COVID vaccine this year? So for 26-27.
Yeah, there's an updated vaccine approximately every year for COVID, just like there is for flu, because these viruses are constantly mutating and you've got to keep up with the different vaccines. So they are going to, actually, it turns out there's a meeting tomorrow to determine what strain that the vaccines should be directed towards, because the virus has changed so much. So the current vaccine is against the JN1 family, but new sublineages XFG and NB181 have emerged, and the WHO is recommending LP81, and it's just updating the vaccine. So they're actually going to decide tomorrow. Very timely question that this person has. And with the technologies they have today, they can easily manufacture that. It should be available by September.
Mhm. And while we're on the topic of COVID vaccines, there was a major release from the FDA regarding the safety of COVID vaccines in children. Can you tell us?
Well, this current administration is very concerned about safety of vaccines, and there have been 96 reported child deaths submitted in the voluntary reporting system to the FDA. They've been investigated, and the US FDA has said that they don't think those deaths are due to the vaccine itself. So there's a lot of ways to determine that. Number one, the most common cause of death was myocarditis, inflammation of the heart. We know that happens with COVID. So and other viruses. So in the whole United States, it just does happen. So if it's from the vaccine, it's typically right after the vaccine is given, in the weeks following the vaccine. So, they did the epidemiological study in all these 96 patients, and our FDA has concluded that these are very not likely due to the vaccine itself, and it's due to some other reason. So I thought that was very encouraging and very bold, because that's of course not what some people really wanted to hear, but it was investigated and that's what they came up with, and this vaccine is safe and children can get very sick from COVID.
Mhm. And speaking of preventing disease in children, the vaccine group Gavi this week has announced that they are going to make some changes in their vaccines that they give out to try to get back with the US funding. Can you break it down for us?
Yeah, so Gavi is this global group that their focus is to administer these vaccines. The United States is one of the founders of Gavi. So they use a variety of different vaccines for multiple diseases, and some of those diseases have a mercury-based preservative in them. And the US pressured them, saying, we're not going to give you this money to give all these preventable diseases out. In other words, like thousands of children will die from preventable diseases. We're not going to give you that money unless you take the mercury out of these few vaccines. So they're going to do it. They're going to eliminate any vaccine with that. I'm sure it's being phased out. This doesn't affect American children. It's already pretty much gone from the American vaccines, but they had to do that in order to continue to give these vaccines and to keep kids healthy. So that's a deal they had to make, and they're going to go forward because the United States government has pledged, and they're holding it up, $600 million in U.S. funding to give this, and so now that will be released if it's not released already.
Mhm. We will keep our eye on that and hope to get more updates very soon. But we do have some good news regarding the hantavirus. The situation does seem to be stabilizing. Can you bring us the latest updates?
Yeah, so one more person has come down with the hantavirus disease. It was a crew member. So now we're up to 12 people who have got infected, including the 3 deaths. There have been no more deaths. So that's good news. So, we have 25% fatality rate so far. We don't know about the woman in France who went back who was very sick. She has apparently not died, but we don't know the status of her. But the very good news is that there's no secondary cases. So in other words, these 12 crew members, everyone got it on that boat, and that none of those people that got it on the boat have spread it to any other person that we're aware of. And that's what was the big concern, this person-to-person transmission. Is there going to be another wave of this? And that does not look like it's going to be the case. Now, of course, we're still following this. We just diagnosed one more person, and who knows how many people that person came in contact with. But I mean, it's going in the right direction because enough people have been exposed to those passengers and crew already, and none of them have gotten sick. Even though they've gotten sick, they didn't have hantavirus. So that's it's good news.
It is very good news. And of course, a story like the others that we will keep our eyes on for more updates. But our final story today, something we haven't talked about the past few weeks, coming back to measles here in the United States. Almost 2,000 cases now this year. Can you bring us the official numbers, Dr. Murphy?
Yeah, so it's 2,000 cases, and this has resulted in 124 measles-related hospitalizations. That's a lot of hospitalizations. We have the 3 deaths from last year that we know about. We don't know about anything else. Other countries not doing so well. In Mexico, they've reported 4 deaths in the past month from measles, and 40 total since the onset of the epidemic in 2025. Deaths, that is. And even scarier, in Bangladesh, 11 addition deaths have brought their total to 490. So very scary. So it's very unfortunate. This is a totally preventable disease with an old vaccine that works really well.
Absolutely. Thank you so much, Dr. Murphy, for bringing us these updates and importantly, keeping us up to date on all of the global outbreaks. It's much appreciated.
Well, great, and safe travels.
Thank you, and I hope everyone had a great holiday weekend. Please join us again next week for Ask Dr. Murphy, This Week in Public Health. We look forward to seeing you back.